allergens, drugs, pathogens, animal waste, gases, and then in the water, the surface water and our groundwater, we're worried about nutrients from the waste, runoff from the waste, pathogens, pharmaceuticals, heavy metals. This is all in the animal's waste. In the soil, we have nutrient overload because way too much waste is being spread on the cropland. We also have drugs and antibiotic-resistant pathogens in the soil. In the food products, there are drug residues from the hormones and antibiotics that the animals are fed, and also pathogens and heavy metals. Slide. So I just wanted to talk about antibiotic resistance. So like I said, the animals are fed a low level of antibiotics in their feed constantly. This is a big problem because, first of all, our antibiotics are a resource for us, and they are being wasted by being given to animals at a low level. They're not being given to the animals to kill infections. They're believed to be a growth promoter, although I've seen research where it's believed that it doesn't even help with growth promotion. But it's being given to the animals to keep them alive, to prevent infections. But at these low levels, you don't actually kill all of the bacteria because that's not how they're being given. So you're going to have leftover bacteria that is now resistant. And actually, I'll explain that with the next slide. But there has been research that antibiotic resistant has been found near animal operations that use antibiotics in feed. Not surprising. Contributes to an epidemic of drug-resistant infections. And it estimated, it's interesting that industry does not have to report on how much antibiotics they're using in these operations. So there was a report that estimated how much antibiotics are being used, but we actually don't know, which is frightening. I mean, information is always helpful and powerful, and we can't get the information of exactly what's going on. But it's estimated that 70% of antibiotics used in the US is used in animal feed. That's not even for treatment when the animals get sick. That's just in the feed. Because, I mean, there's so many animals, you know, it makes sense that it's a high proportion. So like I said, we're compromising this vital resource, and also it causes our medical costs to go up. When you go into the hospital and you have an infection that doesn't respond to the first antibiotic, doesn't respond to the second antibiotic, that gets really expensive. So that's driving our healthcare costs up as well. Slide. So let's say this is bacteria, and then you can click there. So we apply the antibiotic. This is in their feed. All of the bacteria that are susceptible to that antibiotic die, and we have this one left that naturally has resistance, or it has resistance because that antibiotic was used before. And then that bacteria does not have to compete with the other bacteria for resources anymore. So then you're going to have more bacteria, lots of bacteria, that is resistant to that antibiotic. And if you try to use that antibiotic again, it will do pretty much nothing. So that's the problem with antibiotic resistance. Slide. So these are the routes of exposure. We're worried about inhalation. We're worried about ingestion. We're worried about skin contact. We also know that workers carry these pathogens and other substances into their household, into their community. And recent findings have shown that they sampled flies on the Eastern Shore, where all those poultry operations are, and they found antibiotic-resistant bacteria on the flies. And they also, there's a professor at my school, she's kind of crazy. She followed a transport truck full of the poultry on its way to being processed, and she had a soda can in her cup holder, which was completely sanitized. She had an air monitor, and she had sanitized the door handles. And then they drove behind the transport truck X number of times and took samples, and they found antibiotic-resistant bacteria in the environment, on the soda can, on the door handles. So that's what people are being exposed to. It's not being confined. It's out in the environment. Slide, please. Thank you. So what are the health outcomes? So with air, I said we're worried about inhalation. Things that have been tied to living near CAFOs include asthma, bronchitis, cough, headache, nausea, respiratory tract and mucous membrane irritation, infectious disease including antibiotic-resistant diseases. Through water exposure, and that can be through well water or through recreational exposure. Illnesses due to the nitrates in the drinking water, that especially affects children and babies. And then in the infectious disease, you can get chronic diarrhea, stomach illnesses, severe ear infections, and this would be if you're going swimming in the water where there's waste runoff, which you can't tell by looking at the water if it has a high level of pathogens in it. But also through, like I said, the private well water. And then in food products, the problems would be infectious disease with the pathogens that are on the food products, increased chance of antibiotic resistance. And actually this has really not been well characterized. We don't fully understand the effects of arsenic residues in the poultry. That hasn't been very well studied. We don't understand the infectious disease rates that are coming because a lot of infectious diseases that are from eating tainted food are never tied back. So it's a hard thing to study. Slide. Thank you. So environmental justice is also an issue with these sites. First of all, in rural communities are already hurting with economic activity leaving the rural communities, but then also there are these sites that are more, they're not in cities, they're not in suburbs, they're in the rural communities. So then it's an extra insult to the rural communities, and then it makes more economic activity leave because who wants to live near one of these operations, which I'm sure Dr. Weidel will talk more about the economic impacts. There were studies in North Carolina and Mississippi that found that the presence of hog CAFOs were related to poverty level, related to the proportion of black and non-white populations, and also in North Carolina they found related to households on well water, which, like I said, CAFOs are more likely to be located in rural areas, and rural people that live in rural areas are more likely to be on well water. So that's not something that's unexpected, but that's a problem because, as you know, the private well water is not regulated, and it doesn't have to be tested. People are responsible for that themselves, and that's a big problem. Slide. Thanks. So some organizations have weighed in. The American Public Health Association called for a precautionary moratorium 7 years ago. There was a big study around the country the Pew Commission conducted. It was called the Pew Commission on Industrial Farm Animal Production, and the center where I work was involved in supporting that project. And the conclusion was that the Pew Commission says industrial scale farm animal production poses unacceptable risks to public health and the environment. Slide. So with government agencies, I don't know if you're aware of how these types of facilities are regulated, but the EPA is responsible for overseeing the states that then oversee the CAFOs. So the states have to report to the EPA. They have to be following EPA standards on how to regulate these sites. So the EPA is indirectly responsible for regulating all of the CAFOs. In some states, they're directly responsible because the state hasn't developed its own program. And there was an investigation by the Government Accountability Office in 2008, and the result was the EPA needs more information and a clearly defined strategy to protect air and water quality from pollutants of concern. So, not surprising, but very concerning. They don't have enough information, and they don't have a great strategy on how to regulate these operations. The FDA is thinking about restricting the use of antibiotics in the feed of the animals that are produced in this manner. they had a draft guidance called the Judicious Use of Medically Important Antimicrobial Drugs in Food-Producing Animals. The problem is they would like to restrict the use only of antibiotics that are currently considered medically important for humans, but the problem is the ones that are not currently considered, they're not usually used in human populations right now. We kind of need those in waiting when the ones that we have become less and less effective, as they already have become less and less effective. So that is a concern. It's still good to see the FDA looking at the issue and saying anything about it, but it would be good if they took it a step further. And that actually, there's a bill in Congress that is focused on the preservation of antibiotics for humans, and that has the same kind of problem in it. It's looking at the antibiotics that we usually use already. And an important thing to remember about, if you hear anything about that legislation that unfortunately has not passed, it only applies to antibiotics being used in the feed. It does not apply to antibiotics being used to treat an animal that is sick. So it just says that when an animal becomes sick, you need to bring in a vet and then treat that animal for that illness. It only applies to, it only wants to take antibiotics out of the feed. So that's an important thing to remember, that it certainly would not say that no antibiotics can be used on the farms at all. Slide. So some recent developments at the state level, which you may have heard of. In California, a couple years ago, they have these referendums that says the animals should be able to lie down, stand up, extend their wings, turn around. So, and that's by 2015. So they're going to be phasing out the facilities that are currently used. There's also a new law that says that that does not just apply to California, but also eggs imported to California. So that's a big deal. That's a really big deal. It says 10 to 20% are imported into California. So that'll have huge implications. I think sometimes they don't argue for the public health effects when they're arguing for these types of referendums, but that does have a public health effect if the animals need to be spread out more, because maybe then we'll have less animals in one tight geographic area with all that waste all together. So it does have public health implications. Also in Ohio, the Livestock Board compromised with HSUS over the summer, and they're doing a similar regulations where no new battery cages can be built, and so they're going to be phasing them out and those types of issues. So it's kind of going state to state. Hopefully the momentum will keep up. Slide. So some conclusions. The methods used to produce the majority of our food animals, they are polluting our air, water, soil, and food. It causes poor health, makes infections harder and more expensive to treat, and raises the medical costs. Continued documentation of environmental and health problems is very important, which at the center, that's what we're trying to do. And informed consumer choices and political pressure are needed to see the change that we need. Slide. I'd like to thank Peach Bottom Concerned Citizens Group for inviting me, the Socially Responsible Agriculture Project, and the Center, which funds my research. And then if you, just one more slide. These are our resources. We have, our regular website is in the upper left. The Agriculture and Public Health Gateway is on the right, and that, if people are interested kind of in the latest research, that's a good place to go to find different reports and search the literature. And then we have a blog, and I mentioned the 2 courses that we have at the center, and what I forgot to mention is that all of the lectures, all of the readings, they are all available online for free for anyone to see, anyone to use. So if you're interested in any of those courses, I mean, you don't have to sit through every single lecture, but you can just look. It's at the OpenCourseWare site at the bottom. And my email is on the right. So does anyone have any